Hello, this is Michael Van Portfleet with Men Physical Therapy, and I'm here to talk about 3 techniques that we can do for the patients we stratified into the mobility category. So with Jeff's videos, distinguishing between a mobility or a stability issue, these are the patients that you've found to have a mobility restriction. Whether you've found that they have some pain and extension, and through your UPAs you see some hypermobility or hypomobility of one of the joints. This is what we do to help with a treatment for that. So the best treatment that I like to do is in a sideline position here for the lumbar manipulation. And I'm going to go through 3. The first is going to be very general, a long lever technique. The second a little bit more specific, and the last one will be for the TL junction. So you'll have the patient in sideline facing you, and we'll have Max scoot forward here. And again, this is a very general technique. So for here, we're just going to have him bend his knee, hooking his leg behind his opposite knee. Here we'll just have him rotate the shoulder, hand position behind the head, and other hand in this position. Now the key with this is they should feel very comfortable. If I stepped away, they don't feel like they're off the bed or they're going to fall off the bed. But if they do, you can always be up close to him. And here is the key with this technique is a lot of rotation through that lumbar spine. So you want the patient's femur pointed towards the ground. And I like to have a thigh-on-thigh contact. And then secondly, having your hypothenar eminence on the segment of question. So for Max, we think he's the lower lumbar. Again, it's not a very specific technique. So I'll put my hypothenar eminence with my elbow perpendicular to his lumbar spine. Here I will block him in this position, and all of the force is going through the drop. I see a lot of people, they do a lot of rotation. Here, this is just a drop. So with Max, the way you prime this technique is going back and forth with that thigh-to-thigh contact, back and forth, and it's just a drop. And what you want to do is, I usually hit my ASIS on his lateral trochanter of his hip. Here, back and forth, elbow perpendicular to the body, through there. So for the specific technique, we're going to have Max on the other side. And this is great for people who don't have a lot of high-low tables. They have a higher table, but not an adjustable table. This is for practitioners who are either also smaller. And so with this technique, you find the segment of question through what you can do a little bit of passive mobility testing here. And again, we'll have you scoot over this. And again, for Max, we'll say it's L4. So at that point, we'll keep his top leg here, bring his bottom leg in that position, hook behind the knee. Keeping that L4 where it needs to be, I'll take his arm, rotate him, hand behind. And with this position, I like to bring my arm through here. And again, a lot of body contact so the patient feels secure. That way you're at the segment of L4. Here, again, is not a rotation, it is a body drop and a pull through my left arm here. So for Max, I'll kind of do a little bit of rotational testing, passive mobility testing, finding that L4, and through there. Again, a very specific technique, not as global as the first one, but also a very effective technique. Okay, and the last one, we're gonna have Max sit up with your feet off the edge here. And I want you to scoot towards me, just your heels off the edge, so scoot back. So this is for the TL junction. So this is for the patient that you see they hinge a ton through that TL junction as they extend back. This we call the Texas throwdown. So for Max, we're gonna have him with his hands behind his neck. Good. Bring him here. And this is a big one to kind of talk the patient through because this is a little scary to go through first. And you want the table kind of high. You're going to tell the patient, okay, I'm going to hug you, hand behind here. And here you want a good fist to be your anchor mark for where you want the TL junction. So you find that TL junction from the 12th rib over. And here, again, you want to talk your patient through it. So what I do is, Max, I'm just going to take you down to right here. So on 3, I'm going to have you just slouch down into this position as much as you can, and I'll take you down to here. And at that point, you just 1, 2, 3, have them exhale, slouch down, and you want the most of your force when they're in this position at a vector going down towards the hand. So breathe in, 3, 2, 1, breathe out. Good, and then through there. And that you'll hear 1 or 2. When you hear 1, you know that's the TL junction. So those are the 3 go-to manipulations that I do for a mobility classification for our patient. Thank you very much.